I'd like to take this opportunity to introduce today's presenter, Casey McCallick, Chief Experience Officer at Premier Biotech. Casey began her career with Premier Biotech in 2010 and has worked with dozens of top 100 retailers, staffing organizations, and manufacturing companies to implement efficient, compliant, and cost-effective solutions for pre-employment drug testing, specifically using point-of-care oral fluid testing. She was instrumental in collaborating with the development of the OT Scan mobile app, an algorithm which automates the test interpretation and eliminates test subjectivity. As Premier Biotech's Chief Experience Officer, Casey oversees Premier Biotech's 4 sales organization teams, including government, workplace, clinical, and international roadside testing. I will now turn the presentation over to Casey.
Thank you, Danielle, and thank you all for joining us today. We're looking forward to the opportunity to present on solutions to help ultimately expedite the hiring process and get candidates to work the same day. If we take a quick look at the agenda here, we're going to start out looking at some current drug testing trends, specifically looking at Quest Diagnostics just put out their most recent drug testing index. So we'll look at what we're seeing in terms of workplace drug testing statistics. Then we'll move into talking a little bit more about how the hiring landscape has changed, especially coming out of COVID or in whatever COVID type of world we're in right now. And then we'll jump into really comparing rapid oral fluid testing to different methodologies, from urine collection sites or the traditional urine-based testing, as well as comparing rapid oral fluid testing to laboratory-based oral fluid testing, which both of them obviously are utilizing oral fluid testing, but have some significant differences. Then, as Danielle mentioned in the intro, we're going to take a look at our OT Scan app, which is actually an app based on a mobile phone, and it's an algorithm that automates test interpretation and provides electronic documentation of the test result. So really being able to not only provide an immediate result, but one that has no subjectivity, right? There's a reader that does that for you, as well as electronic documentation. We'll talk about how that's really changed the market. And then also, as Danielle mentioned, we've carved out some time at the end to address any questions, and we'll get through as many as possible, if not all of them. So before we dive in too deep, a little bit about Premier Biotech. We are based in Minneapolis, Minnesota. We are both a manufacturer of rapid drug testing devices, urine and oral fluid tests. And maybe I should back up. When I say rapid, we're talking about an immediate result, or sometimes called point of care. It's a result that's available within minutes and doesn't require a sample to have to go to a laboratory. We are also a laboratory. We operate a forensic laboratory about a couple miles from the University of Minnesota in Minneapolis. Our real goal and focus as an organization has been to change the game in drugs of abuse testing. And as it specifically relates to the workplace market, it's developing solutions that allow for more cost-effective, efficient, and accurate ways to get people to work quicker. And so again, our aim has been to work with organizations, and a lot of our kind of niche market is staffing, retail, hospitality, construction, manufacturing, anywhere where there's high turnover and there's a need to get people to work immediately. We're also a very R&D driven organization. So a lot of these tests that are listed here aren't necessarily relevant for the workplace space, but on the government side, most of our customers use forensic panels, which essentially are using the most relevant and emerging trends in drugs of abuse. So we are the first company to bring about a rapid test for ETG, which is a biomarker of alcohol, a heroin-specific test, synthetic marijuana, and of course have really been focused on developing innovative oral fluid testing solutions, because we believe that ultimately across all of the markets, the future of the industry is in oral fluids and getting people out of the restroom and away from urine testing. So we've invested heavily in automating and improving that technology. In terms of technology, I also mentioned the OT Scan app, which we'll actually get to go through a whole demo to show how that works. And again, just being able to provide not only innovative solutions, but extensive and exceptional customer service and customer experience. We know that this market changes rapidly all the time, whether it's state drug testing laws or questions around legalizing marijuana and new technology. And we've been dedicated to continuously bringing about new technology to market and supporting our customers with ongoing continued education. So we'll jump into the current drug testing trends. And again, as I mentioned, we'll focus primarily on data released by the Quest DTI that just came out relatively recently. But overall, if we look at drug test positivity rates, they've increased. And this data is, of course, based in 2021, but they are up to 4.6% compared to 4.4%. This is the overall positivity rate for pre-employment based test using urine. In general, the retail trade industry had the highest overall positivity rate in 21. It was at 7%, which is a significant increase from the last time that this was put out. Over the last 5 years, in general, the U.S. workforce urine drug testing pre-employment positivity rate increased 17.4%, and post-accident is up 26%. And probably not surprisingly, but 17 out of 17 industries saw an increase in marijuana positivity. So again, overall, the question always becomes, we know that coming out of a pandemic where there's all sorts of social implications and mental health consequences. So again, not surprisingly, coming out of this pandemic, we're seeing drug abuse at all-time highs. And so, of course, the question is, how do we make sure that we're testing, because more people are using drugs than ever before, to give us visibility into that and ultimately, So there's a lot going on in this slide, but again, overall takeaway here is as we break it down by industry sector, we see an increase across the board in 2021. We highlighted retail, obviously transportation and warehousing is way up as well. Other services outside of public admin is up, but in general, across the board, we're seeing more pre-employment and post-accident reasonable suspicion positives than we've seen before. We get a lot of questions on how are organizations handling marijuana testing as more and more states are legalizing marijuana. And I know the first bullet isn't necessarily relevant to the workplace market, but I think it sets the stage really well. We do a lot of work in the correctional or criminal justice space, and states are beginning to remove THC from their standard testing panel. This decision is primarily based on the fact that even if they do get a THC positives, in many cases, there aren't sanctions that occur as a result of that. So they're much more interested in testing for the drugs that are driving crime in the streets and the communities, which tend to be the opioids, methamphetamine, the synthetic opioids, or the prescription pills, which are really expensive and accelerating the heroin use. And so as we see government and criminal justice removing THC from their panel, we also see workplace following suit. Many of our customers have decided to remove THC from their pre-employment panel, but they keep it for post-accident random and reasonable cause. This allows them to adhere to state laws that may prevent it, and also opens up the workplace market. The reality is that drug use across the other drugs, whether it's the opioids, the synthetic opioids, methamphetamine, are all higher than they've ever been before. And so, the importance of testing for drugs has never been greater, at least in my opinion. I think sometimes people think THC testing is synonymous with drug testing, and it really isn't. Employers are caring about, the drugs that are leading to theft and shrinkage, because people have to steal to support their habit. The average oxycodone pill on the street goes for $80 a pill. And so, again, these are the drugs that not only from an impairment perspective, but from a cost perspective, employers need to really be worried about. oral tox in general and oral fluid testing has a more limited window of detection. We'll talk a little bit about that in some slides later in the deck here, but essentially marijuana is fat soluble, not water soluble, so it doesn't cross directly into our oral fluid. As a result, you're limited in a rapid test up to 24 hours after use. In a lab-based test, maybe a little bit longer. But a lot of employers love that because a THC positive in oral fluid is a much better indicator of current impairment versus what people did over the weekend. And that's really attractive for a lot of employers, especially as marijuana becomes more legal. Employers are treating THC more like alcohol, in that maybe we don't care as much what happens over the weekend or the night before, but we certainly care if someone is coming to work impaired. So in that way, oral fluid testing is really become sort of advantageous in this environment where companies are wondering what to do with THC. We hear all the time about an increased emphasis on candidate overall experience, and based on extensive studies conducted in market research, as well as I know Current Compliance and Bill Current over at the Current Consulting Group has done quite a bit of work in terms of surveys, and overall it's overwhelmingly positive that candidates prefer an oral fluid-based test than a urine test, whether that's the pain of having to report to a collection site or get themselves there and worry about the nuisance there. But in general, as we hear, especially with the competitive hiring landscape, how do we enhance that candidate experience? Oral fluid is a great avenue to do that. So in the next couple of slides here, we'll talk about hiring qualified candidates before the competition. Again, we know it's perhaps one of the most competitive hiring landscapes, especially for the markets we talked about: retail, staffing, construction, hospitality. It's really tough to get those candidates. We experience the same struggles at our laboratory as well. And being able to offer an on-site test immediately upon job offer and having the opportunity to start candidates same day is a game changer in this market. But before we jump in too much to that, I want to spend a couple minutes talking about urine versus oral fluid testing, because that's probably one of the most common questions or set of questions that we get from prospects as well as existing customers. So a lot of people want to know what's better, urine or oral fluid. And I think the best way to answer that question is that they both have different advantages and limitations, and it's really important to understand what those are. It's not necessarily an apples to apples comparison. Overall, if you look at accuracy, which is defined as sensitivity and specificity, and you compare it to a laboratory confirmation on a GCMS or an LCMS, urine and oral fluid are both, depending on the drug, 98 to 99% accurate, right? They're both very, very accurate, but they have different advantages and limitations. The biggest advantage of an oral fluid test is that it prevents adulteration, which means it prevents people from beating or cheating the test, right? So when we're talking about a workplace test, we've got a candidate going into, let's say, a collection site. They go into a restroom, they shut the door, and really it's difficult to control what happens in there. Of course, a lot of places will blue the toilet water. They'll make people leave their purses or backpacks outside. They'll probably have them wash their hands. But the reality is you can do a simple Google search and find millions of ways to beat or cheat a urine test, whether that's a GNC product, whether that's bringing in some synthetic urine or somebody else's urine, whether that's a little bit of bleach underneath the fingernail, swirling it around in the urine, that's enough to kill any drug that may be present. Or really it's as easy as drinking a lot of water that will dilute the concentration of the drug in the urine and convert positives to negatives. So very simple to beat or cheat a urine test, especially if it's unobserved, which of course in the workplace market it is. With oral fluid testing, the principle of it is that our saliva completely refreshes itself 3 times every 10 minutes. So that's why if you look at any package insert or instructions, it tells you to wait 10 minutes after the candidate has or donor has anything in their mouth prior to administering the test. That's because as long as we've waited that 10 minutes and we've allowed our saliva to completely refresh itself, there's no way identified to be able to beat or cheat an oral fluid test. Another advantage of oral fluid testing is that it will pick up a drug almost immediately after use. So from a post-accident reasonable cause perspective, this is really good because if someone goes out on lunch break or comes into work and has just used, in urine, you're testing for a drug's metabolite. So depending on the drug and an individual's metabolism, it takes between 6 and 14 hours for that drug to show up positive, whereas in oral fluid, within minutes of use, that will show up positive. The biggest limitation for oral fluid testing is really specific to the detection window of THC. For most of the drugs, which will say everything except THC, they're water soluble. So there's not a huge difference if you compare how long will you have a positive in urine versus oral fluid. It will be slightly longer on the urine side, but less than a day. So not a significant difference for basically everything but THC. Opiates, oxy, methamphetamine, cocaine, pretty similar. THC is different. It's fat soluble, it's not water soluble, so it doesn't cross directly into the oral fluid. That is the reason that we're limited to up to 24 hours after use. More realistically, with a rapid or a point of care test, it's probably somewhere between 8 and 12 hours. And what I think is most interesting about, and again, that's specific to THC. That is not the rest of the drugs. That is THC specifically because of it being fat soluble. It's just different from the other drugs. What I think is interesting is that if you would have asked me 4 or 5 years ago, what's the biggest limitation of oral fluid testing, I would hands down have said, well, the limited window of detection for THC. With the climate that we're in today, and again, with companies treating marijuana more like alcohol, and they're concerned with impairment at the job versus what somebody did over the weekend, I think it's actually become one of the advantages, right? Companies can still test for it and protect themselves, but they're not limiting people in states where it's legal and or medicinal marijuana. So, we get more and more questions from companies that say, we want to keep THC on the panel. We think it's a great deterrent. But we also know that the world is changing and we have to treat that differently, which makes oral tox a really good solution for that. So I think before we jump into, it's really important to understand the process and the way that oral tox is used. And really, if we look at this flow chart here, the goal of a rapid oral fluid test is to get candidates to work immediately. So the way a process works is you administer a rapid oral tox, which again is an on-site test. You've got results within 10 minutes. If it's negative, which we know based on, as an average of all the industries based on Quest Diagnostics urine numbers and drug testing from the drug testing matrix, 90 to 95% of the time it's going to be negative, which means nothing else has to happen. Immediately that candidate is eligible for hire, or if we're talking post-accident reasonable cause, immediately that employee can return to work. Right? Nothing has to happen 90 to 95% of the time. That oral tox goes in the trash can. The other 5 to 10% of the time is when we're going to call it inconclusive. Some organizations use non-negative, presumptive positive. We're never going to deny employment or terminate employment based on the result of a screen. And that's true whether it's a rapid test like the oral tox or if it's a laboratory screen. We always want to perform confirmation testing before we're, again, terminating employment or denying employment. The reason for that, and again, this is all screens, this is not just oral tox, this is even if you do a laboratory screen or a urine screen or oral fluid screen, a screen is identifying the presence of a drug class. What it can't do is tell us, is that codeine or is that heroin that someone used, right? Which is why we put it on a confirmation instrument. Sometimes it's called LCMS or GCMS, you may have heard. And then, of course, an MRO officer reaches out to the candidate to obtain a prescription, but only after laboratory confirmation and MRO turns that positive do we deny employment or even refer to that as a positive. So again, oral tox is a great tool to get candidates to work immediately, same day eligible, 90 to 95% of the time. The other 10% of the time, we want to make sure we go down a different route to provide confirmation testing, but this is going to expedite that hiring process significantly, 90 to 95% of the time. So let's look at the value proposition of why rapid oral fluid testing, and we'll talk specifically about oral tox here, versus traditional urine collection sites, whether that's Quest or LabCorp or eScreen model. So First, we'll talk a little bit about, well, why is it so important to accelerate the hiring process? And I think we all know that based on today's hiring landscape. And if you don't get candidates that day, many times they've already accepted another position. Or if you're waiting 2 to 3 days for a lab test and you reach back out to that person, by that point, they've already accepted a position. The evolution of the background check has really increased the need for the drug test to take place faster, right? So when background checks used to take a significant amount of time, it didn't necessarily matter that you couldn't execute a drug test immediately. But with AI and automation and how quickly background checks can be executed now, it's become all the more important to be able to conduct the drug test and be able to offer that person a job right on the spot. So when we talk about traditional collection sites, again, we're referring to a model where we're sending somebody out, whether it's a Quest, a LabCorp, an eScreen, whatever the case may be, and asking them to report to that site for a urine-based collection. One of our staffing clients last busy season reported to us that 60% of the time that candidates were told to go and take this drug test, the test never took place. That was a combination of maybe they just decided, forget it, I'm not going to do it, I can go get a job across the street. Maybe they showed up to the collection site and found out they had a 50 to a 75-minute wait and they said, forget it. Maybe they didn't have transportation, so they could never make it there. Maybe the collection site had significantly reduced hours for testing and it just wasn't a possibility for them to get in. Maybe the candidate had concerns for health and safety reasons because a lot of these collection sites were also acting as COVID testing sites. So that's the last place that somebody wanted to go. But ultimately, that's a number that our staffing client gave us. 60% of the time, that test never took place. We call that the drop-off rate. So this will resonate with I'm assuming most of you on the call today, right? And this drop-off rate of, if that happens, now you've gone through the whole process of finding the right candidate, offering them a job, hoping that they're going to start in a couple of days, only to find out a few days later that they no-showed, right? And now you're starting the process all over. So the value of being able to give someone a rapid oral fluid test on the spot upon job offer, have them, 90 to 95% of the time that's negative, and they can begin work. For a lot of our retailers, they're beginning the night shift that same day. So same day eligible is a word we talk about all the time, but that's a huge value proposition there. I mentioned Bill Current, who's the president and founder of Current Consulting Group earlier. His organization is obviously really involved in the industry in terms of writing drug testing policy, reviewing policy, as well as doing market research. And I've included a quote here. But overall, Bill and his group believe that oral fluids truly are the future of the industry and the market. From that candidate experience perspective and a donor-driven process, you're testing yourself. It's not invasive. There's really no ick factor like urine testing sites, as well as being able to, again, accelerate that hiring process and get people to work immediately. We talked a lot about this, but again, oral tox is a way to essentially have the donor test themselves. You have them right there. We don't risk sending them to a collection site and that drop-off rate. We've got 100% observed collection, which means that as long as they don't have anything in their mouth 10 minutes prior to the test, they can't beat or cheat the test. And now we have the ability to offer somebody a job same day. This is a case study conducted. We onboarded a large national pharmacy retailer about a year and a half ago, and they put this together for us. They say they moved from traditional urine collection site based testing, and they saved $1 million by making this switch to rapid oral fluid testing. Obviously, the money is a big consideration, but even bigger perhaps for them was the ability to, again, place those candidates immediately, not risk the drop-off rate. There's additional cost savings, right, in ROI by not, which isn't factored into this $1 million of all the times that they did find the right candidate, they sent them to a collection site, that person had accepted another job, now they start the process over. There's, of course, costs associated with that, but those are not reflected. This is just $1 million in the drug testing program itself. This ROI calculator is a staffing model that we put together. So for those of you on the call that come from the staffing market, I know you're familiar with this, but for everybody else, staffing companies make their money in billable hour revenue. So it's all about accelerating that process and getting those candidates to work immediately. But we put this together. This is another real case study with another staffing company, separate from the one that reported that 60% drop-off rate in a few slides ago. But this was based on one of their higher volume locations that placed 1,000 candidates a month. These numbers can get astronomical really quick. So when I use this, I like to break it down by per office instead of if you're talking about, someone with a national footprint that has, hundreds or even thousands of locations, because again, the numbers can get almost unbelievable really quickly. But if we base it on 1,000 tests a month, assuming a 4% positivity rate, which would be 40 tests, and let's assume a background check is $33. If the idea here is that we're not going to initiate that background check until we have a negative drug test, right? Until that candidate has passed the drug test, on background checks alone, we're going to save $1,320. Okay, well, that's great. If we look over here at the rapid oral fluid test savings, let's say price for a lab-based test is $22, the price for a 4-panel oral tox is $8. That's a $14 savings per test, which equates to $14,000 of savings. This is per month again, per month in the test itself. But the biggest impact here, or the biggest ROI, is in the increased billable hour revenue. Again, talking about how staffing companies make their money in billable hours. If we base that on 1,000 tests times, let's say the average lab is coming back in 2 days, we're missing 16 hours of billable hour revenue. And let's assume an hourly rate, which I think is incredibly low at $14 an hour. We're talking about an increased billable hour revenue for that one office in 1 month of $224,000. So again, we have this in an Excel document if anyone liked this as a follow-up. You can plug your own numbers into this, but you can see that the numbers can get astronomical really quickly. So next we'll move into, there's a lot of companies that have bought in and understand the value of oral fluid testing. They love that it's resistant to adulteration, so candidates can't beat the test. They love that it enhances the candidate experience because people prefer to do an oral fluid test than have to go provide a urine sample in a bathroom. It saves them the drive to the collection sites. They love the idea of oral fluid testing, but they're using laboratory-based oral fluid testing, which is essentially you eliminate that drop-off rate to some degree, right? Because the principle of a lab test is that you're going to collect the oral fluid after you extend the job offer and the candidate is sitting right there in front of you. But instead of having the rapid results, you're going to take that sample, put it into a vial that has a little bit of a buffer solution, that's shipped off to the lab, overnighted typically, and then, best case scenario, it comes back next day. Worst case, I've heard from clients now, 5 to 7 days, but probably more in that 1 to 3 day range. So the good news is you don't have to get that candidate to report to a collection site. So we significantly reduce that drop off rate. The bad news is you're doing 200% of the work because you've got to collect the sample, you've got to fill out all this chain of custody paperwork, and it has to be filled out absolutely correctly, because if a signature is wrong, if you're missing a date, if the initials don't match, any of these things happen, it can cause the sample to be rejected, which just means you're starting the process over, right? So you're doing 200% of the work in filling out all this paperwork. You got to ship it out to the lab, which is frankly the most expensive part, is the overnight shipping to the lab. So it's not cost effective, and you're still waiting, let's say best case scenario, 1 to 3 days for those test results. Well, in today's competitive hiring environment, we're still hearing that the drop-off is an issue because by the time you call the candidate back and say, okay, great, you've passed this drug test, they've already accepted another position or you can't get a hold of them, right? So we think there's a huge opportunity for companies that, we don't have to educate on why oral fluid testing. They already understand all the benefits, but they're doing all this work with a laboratory-based test and none of the benefit of immediate same-day results. So we have another retailer that we just rolled out, a huge online retailer that wanted to do, so they were moving from laboratory-based oral fluid testing, which they've done for years, and wanted to utilize oral tox. Their concern was that They were very comfortable with lab-based oral fluid testing. They had been doing it for a long time. They were concerned that oral tox wasn't going to be as good or as accurate, and it was going to miss some of the drugs that they were able to pick up in lab-based testing. So what we did for them is, before we rolled out the organization nationwide, we did a pilot with 10,000 oral tox devices. And obviously the biggest impact for them was that 95% were negative, and it allowed them to begin work same day, right? So that was huge for them. Instead of waiting 1 to 3 days, and we were hearing from this company that it was sometimes up to 5, they were able to get those candidates to work same day, which again, that was the biggest impact on their business. But what they wanted us to do was to select 20% randomly. They sent in every oral tox, whether it was negative or positive, to our laboratory. We randomly selected 20% of those and ran those samples through LCMS, or a confirmation, and we had 100% correlation, meaning that every oral tox that was negative, when we put it on an LC to very, very sensitive levels, we did not miss one hard drug that was being used. And so ultimately that gave them the confidence to know, no, we're not missing anything in oral tox. And this company in particular, they removed THC from their pre-employment panel. They kept it for post-accident, but they did remove it from pre-employment, so these numbers don't include THC. But they weren't missing anything. In fact, they found more positive opiates, methamphetamine, and cocaine than they would have with the lab-based test. So they were incredibly encouraged by that piece, and that ultimately gave them the confidence to roll it out nationwide. When we look at the 5%, I mentioned that this is the same case study here, but 5% of the oral tox devices were non-negative, that aligns pretty well with industry-wide pre-employment positivity rates. Here's the breakdown by drug. Amphetamines, which also includes methamphetamine, was 60%, oxycodone was 8%, opiates were 12%, and cocaine was 20%. Again, it's pretty well aligned with retail numbers that we see, but these were true positives. And the thing to emphasize here is that oral tox didn't miss any of them. So the company was able to move to a more cost-effective solution, solve the issue of having to call the candidate back a day or 5 days later when they had the results and find out they had another job. So they were able to expedite that hiring process and get them to work immediately, and they didn't lose anything in terms of sensitivity and product performance. Now we're going to move into, so we talked about there's a lot of companies that have recognized the benefits of oral fluid testing in general. As I go through this, I'm guessing there's people on the call that say, yeah, this is great. I would love the opportunity to save a bunch of money and save a bunch of time and expedite the hiring process, but I'm not comfortable with my employee reading the test result and making that determination. Or how do I provide electronic documentation? Because right now I'm using, let's say, eScreen, and I have a nice electronic document that shows the record that if I'm a staffing company, I can provide that to my clients. If I'm a retailer, I can save that in the candidate's file. How do I get that electronic documentation? We developed and launched the OT scan at the end of 2019 to solve for this problem. Since then, we've built in some enhancements that I'm super excited to show you about. But ultimately, the OT scan, as I mentioned, is an app available on iOS as well as Android that automates the test interpretation and takes the subjectivity out of the test. Maybe I should back up a second and introduce Oral Tox, which is our rapid oral fluid testing product. It does have an FDA 510K clearance, which is important because let's say there's a dozen or so states that do require an FDA cleared device. So for any company with a national presence that wants to use the same solution across the organization, it's going to be really important to use an FDA cleared device. Oral Tox in the workplace market can test up to 10 drugs. In the criminal justice space, we can go up to 12. One of the biggest differentiators of Oral Tox itself is that it does have this own unique QR code that ties back to this specific device, and also can be used with the app, which I'll talk about in a few slides here. And also, Oral Tox is unique in that once the saliva is collected, the collector goes into the test device and it locks into place, forming an airtight barrier. And this particular device can actually be sent directly to the lab for us to perform confirmation testing on. So if it is non-negative, You don't have to do anything else. Send the oral tox in. We can provide or can conduct the confirmation testing with that same sample. And there's actually several state laws that require confirmation testing to be performed on the same sample that was screened. So that checks the box in that area as well. And then I'll say the third biggest differentiator is that it does work with the OT scan app. So oral tox can be used as a standalone. We sell tens of millions of these a year. And we have a lot of customers that just do the visual read. But as I mentioned, there's other customers that just aren't necessarily comfortable with their employees doing that. So you also have the option to use it with the app, but it can be used both as a standalone or with the app-based solution. I did include this information just showing the product performance overall, outlining sensitivity, specificity, and accuracy. There's a lot going on in this slide, but ultimately to get FDA clearance, you have to demonstrate the product performance, and you can see it performs really, really well between that 98 and 99% correlation with LCMS. There are, as I know most of you know, a lot of different state laws around workplace drug testing. So about between 450 to 600 unique state laws. It's a lot to keep up on. We tried to simplify it a little bit by putting this together. In general, what this means is the green states, there's no restrictions, or rapid oral fluid testing is a go. The red states, which include Puerto Rico, Vermont, and the city of San Francisco, oral tox would be prohibited, or in San Francisco, drug testing itself is prohibited. The orange states require an FDA cleared device, which, good news, oral tox is FDA cleared. So all of these orange states would be okay as well. And then the yellow states are questionable. So depending on, we have a lot of different customers and their legal teams interpret laws differently, some more conservative than others. A couple of the states like Minnesota and Kansas, Nevada and Montana have what are called clinical lab laws, which essentially the way that the law is written says that the results need to be interpreted by a certified laboratory. And so using the OT scan app, which I'm going to demo in the next slide here, actually checks the box in those states because the algorithm actually goes through our laboratory information system. And so instead of it being a point of care test, it's actually more of a lab developed test in that the algorithm is going through the lab. So again, we've got a lot of customers that are really excited because maybe they were using us in all the green and orange states previously. And then once we developed the OT scan app, they could expand oral tox usage into these other states. As I mentioned before, OT scan app is available on both iOS and an Android platform. I will walk you through basically the screenshots here. So we provide username and password credentials. The first time you log in, there's a licensing agreement. The next page, and of course this will only show up the first time, you would click on manual order, enter in very basic donor demographic information. Our goal in developing this was to keep the keystrokes as minimal as possible and really make this intuitive. So you enter donor name, date of birth, donor ID or employee ID, whatever you may use, as well as gender. The next screen is the donor consent. So they will click and attest that they are who they say that they are and provide an electronic signature. Next, the collector signature. So the collector is going to sign their name. That would be the test administrator, as well as indicating the reason for the test, pre-employment, post-accident, reasonable suspicion, or random. This screen here shows where we're going to capture the QR code. And as I mentioned, that ties back to this specific device. So by grabbing that information, we're going to auto-populate the lot number, the expiration date, the requisition number, which is a unique 12-digit code that ties to this device, as well as the combination of drugs that are tested just by grabbing that picture, which happens in a microsecond. Next is time to interpret the test. So the way that that works is very similar to depositing a check online. You'll see the dotted outline of a label of the oral tox. It'll start out red. As you pan in and out and bring the phone into focus, it will turn yellow as you're closer and green once you've captured that result. Immediately it generates this next page here, which has a date and time stamp that the test was performed. We have a record that it's a negative test, as well as the donor details. If you click on the bottom right menu, we can see this next screen here, which shows an image of each of those test strips. Nothing is stored on the phone. All of this is wiped off the phone immediately when you click done, and it's saved in our backend portal, which is our laboratory information system. The new functionality that we just released about a month ago is the confirmation capability. So if we're going to call it inconclusive, meaning non-negative. The next screen that would pop up is this one. And in this case, we're going to click on oral tox and click continue, meaning we want to provide or conduct confirmation testing using the oral tox. We're going to have the donor sign again, or the collector sign again, just because this is going to generate a chain of custody form on the back end. There is absolutely zero paperwork that has to be done to send oral tox into the lab for confirmation utilizing this platform. All of this is creating a back end chain of custody form that our processing team will print out as soon as they receive the sample at the laboratory. So completely paperless, no way to mess this up, no way, outside of putting a label on that gets ripped in transit to mess this up to cause the sample to be rejected. But we're going to collect that collector signature again. We will provide you with security seals that basically it's this seal here that has a little barcode on there. On this next screen, it will prompt you to enable your camera to take a picture of that barcode, which is then placed centered over the top of the device. It's the security seal to make sure that we're forming a tamper evident barrier. So when our lab team receives the sample, they make sure that that tape is intact. This screen here, we're going to capture the donor telephone number again. That's in case the MRO needs to reach out to them. We want to make sure that we have that entered twice and that the information is correct. And that's it. You click continue. At that point, oral tox goes directly into a bio bag and into a FedEx lab pack, which is an overnight ship to us. We provide all of those materials. We receive it first thing in the morning the next day and immediately get that onto the instrument. Lab turnaround time, typically the bottleneck is the MRO process, but the lab results are typically 24 to 72 hours. We try to be closer to 48 on that, but again, nothing is going to the lab unless it's non-negative. So 90% of the time, nothing else happens with that. It's only 5–10% of the time that those samples even need to go for confirmation. Otherwise, in terms of turnaround time, your turnaround time is minutes. We have a bunch of resources here, which I'm sure Danielle will be making available in a follow-up or this presentation, as well as the recording. We have training materials, procedure guides, as well as additional information on the OT Scan app. I think we might have perfect on time, maybe a little bit early, but we have completed the content and the presentation, and we can turn it over to Q&A.
Thank you, Casey. We'll now dedicate the remainder of the webinar to addressing our attendee questions. If you haven't had a chance to ask your question, please use the chat bot or the questions box in your panel to do so now. So Casey, the first question that we have is urine testing or oral fluid testing more accurate?
Great question. And I think this is, we can follow up. I'll send over to you, Danielle, but we just finished filming we have a resource, but we finished filming a couple-minute video that I think does a really good job of talking through this. But I think the important thing is if you look at accuracy, just as accuracy, urine and oral fluid are about the same, 98 to 99%, depending on the drug. The difference is in the different advantages and limitations, and remembering that it's not an apples to apples comparison. So oral fluid advantages are that you can't cheat the tests, as well as immediate detection of the drug. The limitation is that we do have a shorter window of detection for THC in oral fluid than we do in urine. However, as I mentioned, because of the landscape we're in today, that might actually have become a benefit. And so what's interesting is if we look at true positives, even though in oral fluid, we know we're going to miss some THCs that we're going to see in urine. We just will. It's going to hang around longer in the urine than the oral fluid, but we actually see higher true positives in oral fluid, even though we miss some, because you can't beat or cheat the test. And so in terms of accuracy, if you just want to break it down in numbers, they're both really accurate. It's really understanding those advantages and limitations. And as I noted that we believe, and certainly Bill Current and other industry experts are articulating, is that we think the future of the industry is really in oral fluids.
Great. This seems to be a popular question. What are you doing for companies and recruiters that are working remotely? How do we continue to test them?
So we had a couple at the beginning of the pandemic, or maybe a few 6 months in, we had a ton of companies that were challenging, existing customers that were challenging us to come up with a solution. And so we did develop a remote solution. The challenge with it is that basically it's a proctored solution where a candidate can schedule a test with our team of collectors. They set up the time, watch them, you ship the supplies to them, you watch them on the screen. But the challenge is if it's non-negative, getting that sample to the lab and knowing what to do with it, right? Because you're relying on that individual. So we developed it and then we kind of sat because it wasn't perfect. And most of our customers were talking about, and they still are talking about it, but no one's really figured out a really efficient way to do it. We do have customers that utilize Oral Talks and they conduct their own testing, meaning that they're setting up some type of video call, like a GoTo meeting or a Zoom. They're shipping the candidate, so they schedule the meeting, they overnight ship them an Oral Talks device. They set up a call, they watch them do the Oral Talks, they have them show it through the camera. That's what I would call maybe the manual option. There are a lot of platforms right now that were developed for proctoring COVID testing right from home across the industry. This is not specific to Premier Biotech. So we're having calls all the time with different companies that develop this technology and now they're not really sure how they're going to use it. So I absolutely think within the next 6 to 12 months, there's going to be a much better solution than exists today. As I mentioned, I think the pain points are really the shipping piece. How do you get the sample to the lab? Because now you're relying on a candidate to ship it back if it is non-negative, and even the cost associated with shipping the device to them. And the other challenge is to have a proctored solution, it would have to scale really quickly and be using it, on a large scale for that to be cost effective. So I just presented at a conference of, I don't know, maybe 2 months ago, and this was one of the most popular questions that was asked. And the reality is that there's just not a really good solution that exists today. There are solutions, but I don't think any of them are perfect. But ask me in 6 months from now, and I think there will be one that solved the real problems that exist. So I guess stay tuned.
Fair to say. All right. The next question that we have is, if we are interested in piloting rapid oral fluid, what would you suggest is the best way of going about starting?
Yeah, I think the best way to pilot it is you really do have to get buy-in. So I like to recommend choosing either a few regions or locations, between 3 and 5 different locations that are relatively high volume users. It's tough if they're going to use 2 a month to really get a feel for it. I would say choose higher volume locations so you can really get an idea of how it works, what are the pain points, where the problem's going to be, to sort of brainstorm around those. But I would identify locations. We typically, and we could work with AccuSource, or AccuSource can provide the training, would go through training just to make sure that all the test administrators are very comfortable with the testing procedure, as well as understanding the process for how do you handle a non-negative. But after, training can exist in a webinar form. We certainly do on-site things as well. However you would like that to look, we can be super flexible. And then we typically recommend doing at those higher volume sites, like a 1 month to 2 month testing, right? To really get an idea of what are positivity rates, how is it working? Again, as I mentioned, what are the challenges? Get a real good indication of ROI, right? How much money and time are you saving? But typically when we do this, our pilots then extend into gradual rollouts, and they take those initial 3 to 5 pilot sites and they call it, we're going to expand upon the pilot and we're going to add 5 to 10 more sites, and then it just becomes this gradual rollout. But I think that's the best way to start.
Great. The next question is, with the legalization of marijuana, our organization is discussing removing THC from the testing panel. Is this something that you are seeing from other companies?
Absolutely. I think in particular retail is removing THC from their pre-employment panel, but they're keeping it for post-accident, reasonable cause, random. Again, and that's beneficial with oral fluid testing because we know if a THC is positive, it's a much better indication of current impairment versus what someone did over the weekend or last night. And so, yes, we're getting those questions every day. I think retail has moved the fastest. I think some industries may not change on that. Staffing obviously is driven by what their clients are asking for. But the good news too is that we have a lot of stocked inventory, preset configurations are on the shelf and ready to go that remove THC from the testing panel. So, there's a lot of right out of the box solutions that exclude THC testing.
Fantastic. So it looks like this may be the last question that we have. Once again, if you have any questions that haven't been addressed or you're still wanting to type them in, there's still a little bit more time left. Otherwise, maybe this may be the last question. So the question that we have is, how have clients utilized oral tox for pre-employment testing at hiring events with multiple individuals requiring testing?
Perfect. Yeah. So I think oral tox application works best for high volume hires and at job fairs, right? So the idea is that it's a donor driven process. The candidate or the donor is essentially testing themselves. So I'm on site for a ton of hiring events. I do this a lot. I did way more before COVID, but I certainly am very familiar with this. And in a lot of cases, you'll have a conference room full of 20 people with a couple test administrators, and it's very easy to observe that many people at once. So essentially they're offered the job, they do their paperwork, they walk into this conference room, and everyone can be conducting it at the same time. We have other clients that have set up basically mini kiosks where once the candidate completes their onboarding paperwork, they basically go into this little kiosk and essentially it guides them through testing themselves. But I think that, again, the real application of this is that it's donor driven. So one test administrator can be overseeing 10 to 20 people if you wanted to at one time. So it's super scalable, super efficient. And it is a perfect solution for those busy hiring events.
Awesome. Thank you, Casey, for facilitating this informative webinar, and a special thank you to our attendees for joining us today. If you have any additional questions, please contact us at marketing@accusource-online.com. On behalf of the AccuSource team and Premier Biotech, we wish you all an enjoyable day.